Hello everyone, I am Dr. Teyshi Bodjalla, consultant doctor in Fidicus Homeopathy. In last video, we discussed about what is vaginal pain and its types and the signs and symptoms of this vaginal pain are discussed in a clear manner. In this video, we will focus mainly on the causes and risk factors for vaginal pain and the necessary investigations to rule out this vaginal pain in detail. I can explain this clearly on the board. Let's move on to the board. Chronic vaginal pain. It means technically we call it as Vulvodynia condition. This is the pain that lasts for more than 3 months in the vulval area, outer part of vaginal area without any identifiable cause. This condition is mainly seen in reproductive age women. Now move on to the main topic. Usually there is no clear causes for vaginal pain. This causes for vaginal pain is usually due to exclusion method. Exclusion method means we can rule out the other possible condition to diagnose this vaginal condition, that we call it as Vulvodynia condition. Firstly, there is no exact cause for this vaginal pain. Unlike that other condition, there is no provoking factors for this condition. It is a multifactorial condition. Major cause of this condition is due to nerve injury. Nerve injury or irritation. This nerve injury or irritation, it means there is damage in the nerves in that area of vulvar region, nothing but an outer part of vagina. So this damage, there is hypersensitivity of nerves in that region. By small stimulus, we can perceive the pain severely. So this condition, we can get the vaginal pain. Now hormonal changes. Usually hormonal changes plays an important role in this condition. Especially there is fluctuation in estrogen levels mainly during menopause condition and also in after childbirth condition. Due to this fluctuation of hormones, there is dryness, thinning and also irritation in this vaginal area. So this we can perceive the pain. And also spasm in pelvic floor muscles. Usually spasm and also tightening of pelvic floor muscles causes continuous irritation of the nerves in that region, causes pain in that region, so that we can perceive the severe pain, especially during intercourse time and also prolonged sitting and also doing some physical exercises like cycling, yoga exercises, something. By spasm of pelvic floor muscles also we can get the vaginal pain. Chronic inflammation. Inflammation nothing but the redness, swelling of the pelvic floor muscles. Due to continuous irritation, it causes swelling and irritation of the pelvic floor muscles. So this inflammation, we can get the pain. And also genetic susceptibility. Usually some women have tendency to develop this vaginal pain like vulvodynia condition. So that woman can perceive the pain, so the pain pathway of that family tendency. So there is more getting chance of pelvic pain. Now coming to genetic susceptibility. Usually some women having tendency to develop this vulvodynia condition, nothing but vaginal pain. Due to this, they are more prone to this vaginal pain because of family tendency and also the pain pathway passing in that family. And also history of recurrent infection. History of recurrent infections like if the patient is having recurrent infections like vaginal, bacterial, sexually transmitted infections and also urinary tract infection. Due to this infection, there is continuous irritation, discomfort in the pelvic area. So this infection, they can persist the pain severely. Lastly, psychological stress plays an important role in this condition. Psychological stress can worsen the condition also. This can disturb the body's natural healing capacity and also increase the pain perceiving capacity and also hypersensitize the condition also. So psychological stress plays an important role in vaginal area pain. Other than this, some additional conditions like using soaps, detergents and also chemicals can cause persistent pain. And also in some conditions like overuse of antibiotics in infection conditions can also cause irritation, discomfort in the vulval area, nothing but the external part of vagina. And also having history of previous gynecological surgeries, sexual traumas can also affect this condition. All these conditions can lead to the vulvodynia condition. We call it a chronic vaginal pain. This is all about the causes and risk factors for chronic vaginal pain. Now coming to the necessary investigation for this chronic vaginal pain. Usually there is no specific investigations for this test, but clinicians can discover this diagnosis through exclusion method. Exclusion method is nothing but we can rule out the other possible conditions. Usually the first and foremost diagnostic test is taking detailed history. Taking detailed history means doctors can take the detailed history of pain, where you will get the pain, what triggers it, when you feel the pain, and also about the sexual history and also the gynecological history. All should be taken in this condition. By using this history, we can rule out the diagnosis of chronic vaginal pain. And also doing physical and pelvic examination. By doing physical and pelvic examination, we can diagnose the chronic vaginal pain. Physical examination means doctor can inspect the outer part of vaginal area with gentle touch and pressure, so that doctor can know the which part of vaginal area is painful and also what triggers it. And also in some cases pelvic examination should be needed. Pelvic examination is done by using speculum. Speculum is an instrument that is used to visualize the cervix and the vaginal wall. So these examinations we can rule out the diagnosis of this chronic vaginal pain. And also performing cotton swab test. Performing cotton swab test is the most common test for this chronic vaginal pain. Doctor can visualize your vulval area with a thin cotton swab like this. By using this method, doctor can examine all the areas of your vulval region. By using this, we can feel any pain are there or should be known. This is one of the confirmation tests for chronic vaginal pain. And also Ruling out infection. Usually some infections like yeast infection, bacterial infection, sexually transmitted infection should be ruled out by taking some samples of this vaginal flora, cervix, and by using these samples we can rule out the condition of the vaginal pain. Because remember, this condition of vulvodynia is not due to any kind of infections or also any kind of poor hygiene, sexually transmitted infection. It is mainly based on some underlying causes and also selected cases. And in some selected cases, some advanced techniques like biopsy and colposcopy should be recommended. Colposcopy is nothing but medical procedure where doctor can visualize or magnify the vagina, vulva, and also the cervix area clearly by using colposcope instrument. Biopsy is nothing but the taking a sample of your body. By using this sample, you can test laboratory to rule out the other causes of spasms and also the any type of infections are there. This is all about the investigation part of chronic vaginal pain. Remember, this chronic vaginal pain is diagnosed based on the exclusion method. Doctor could examine all other possible ways of infection. By excluding all these possible ways, we can rule out the diagnosis of this condition. This is all about the investigation part of chronic vaginal pain. If you are suffering from this chronic vaginal pain, consult Fidicus Homeopathy. What do you get from Fidicus Homeopathy means the success of case mainly depends on three main steps. One is the treating doctor, second is the drug device we are using, and third one is the infrastructure we have. At Fidicus Homeopathy, doctors are with passion, qualification, knowledge, competence and compassion, and the drug device we are following is of top quality medicine. We are getting our medicines from best pharmaceutical industries and we are also best in segment. Fidicus Homeopathy is the first homeopathy using latest technology and also artificial intelligence as a treatment option. By using this latest technology and artificial intelligence, we can give better results to the patient. This is all about the advantage of selecting Fidicus Homeopathy. Now coming to the consultation part of Fidicus Homeopathy. If you are suffering from this chronic vaginal pain, you want to get consultation Fidicus Homeopathy. Fidicus Homeopathy provides two types of consultation. That is online consultation, in-person consultation. In online consultation, audio and video call option available. By using this option, you can share your reports to us. If any reports are necessary, we will let you know. You can collect it locally and get it back to us. After completing the case taking, we will ship your medicines to your doorsteps wherever you are in the world. If you are staying in India, it will take 3 to 4 business working days. If you are staying other than India like USA, Canada, etc., it will take 3 to 8 business working days. And also, if you want to consult Fidicus Homeopathy by in person, you can visit our nearest branch and get consultation. This is about the consultation part of Fidicus Homeopathy. Now coming to how to get consultation Fidicus Homeopathy. This is our WhatsApp number 7997101303. By using this number, you can call or message to us and get consultation. If you have any doubts about Fidicus Homeopathy, this is our website www.fidicus.com. By visiting this website, you can also get consultation. This is all about the consultation part of Fidicus Homeopathy. If you are suffering from chronic vaginal pain like vulvodynia condition, Fidicus Homeopathy is the best option because Fidicus Homeopathy stands for highest chance of health. And also Fidicus Homeopathy mainly follows on three main principles. That is highest success rate, transparent treatment, and also personal care. Regarding chronic vaginal pain, Fidicus Homeopathy having highest success rate. You can treat and guide the patient with safe natural medicines. And also we are providing transparent treatment. Transparent treatment in a sense, we can explain the condition to the patient and also the prognosis of the disease condition to the patient. And Fidicus Homeopathy is also providing personal care. Personal care in a sense, we are providing unique treatment and also individualization to the each and every patient so that we can give personal care. And also we can clarify the doubts about the disease condition and also provide healthy advices to maintain healthy life. These are all about the advantages of selecting Fidicus Homeopathy. If we are suffering from chronic vaginal pain like vulvodynia, Fidicus Homeopathy is the best option for safe, effective and natural holistic treatment. Now we discussed about the causes and risk factors for vaginal pain and also the necessary investigations required to diagnose this vaginal pain in a detailed manner. So vaginal pain can disturb the health and also daily life, but you don't have to suffer it silently. Fidicus Homeopathy is here to guide you with safe natural treatment and also helps to maintain healthy and balanced life. Thanks for watching.